Hello everyone. This presentation is on Huang Tang, also called astragalus, and cinnamon twig 5-herb decoction. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Huang Tang belongs to the category Tonify Kai. A representative pattern is Kai and blood deficiency with numbness, slight aversion to wind, and weak circulation. Important ingredients include Huang Kai, Gui Zhai, Bai Shao, Sheng Jiang, Da Zhao. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 60-year-old man with diabetic neuropathic numbness and spontaneous sweating. The current medicines are metformin, tacrolimus, aspirin 81 mg. This case gives a possible reason to consider Huang Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Huang Kai plus tacrolimus. The mechanism is that astragalus may stimulate immune activity and may be undesirable in an immunosuppressed patient. The clinical significance is uncertain but important. My management plan is use only after transplant team or specialist approval. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Gui Zhai plus metformin. The mechanism is that cinnamon-related constituents may have additive glucose-lowering effects. The clinical significance is usually low to moderate. My management plan is monitor glucose and dizziness symptoms. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is Sheng Jiang plus aspirin. The mechanism is that ginger may add mild antiplatelet activity. The clinical significance is low to moderate. My management plan is watch for bruising or GI bleeding symptoms. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Huang Tang may be reasonable when the patient truly matches the pattern Kai and blood deficiency with numbness, slight aversion to wind, and weak circulation. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.